Hello everyone, my name is Wang Yongle, and this is my pre-departure video for AKRT1. Let's watch. Before attending my first clinical practice, which is AKRT1, I have received my 2 shots of vaccination of hepatitis B at a clinic nearby my home. I also attended the clinical practice briefing given by the PDR lecturers and clinicians to know the do and don't during my clinical attachment. For hygiene purposes, I make sure to trim my nails.
For the dress code, we are required to wear formal attire with black long pants and a lab coat. For shoes, I decided to wear my black leather shoes. We also need to bring along our matrix card and OSL dosimeter.
Besides that, I also review the basic patient care knowledge that I have learned during my Year 1 study, such as taking vital signs like blood pressure, temperature, oxygen saturation, and the procedure of ECG, as well as revising the normal range of each vital sign. For transportation, I will take the bus to HCTM on my first day of clinical practice, prepared by the clinicians. The bus departs at 7 a.m. from the faculty, so I have to arrive there at least 30 minutes early before the departure. If there is no bus provided, I will use e-hailing services such as Grab to reach the hospital. I will need to leave an hour early before my shift starts to avoid traffic jam and arrive on time. After I arrive at the hospital, I have to report myself to the unit latihan of HCTM to check in and proceed to the oncology ward to begin my first clinical practice. I have done a little research about the organization of the radiotherapy and oncology department at HCTM.
It consists of Radiotherapy Planning and Treatment Unit, Oncology Daily Treatment Unit, Radiotherapy and Oncology Clinic, and Oncology Ward Tengku Ampuan Afzan. The head of the Radiotherapy and Oncology Department is Professor Datuk Dr. Fuad Ismail.
Our supervisors during the clinical practice of AKRT1 is Madam Ainun Zubaida Mohammed. If I have encountered any problems or I have any questions during the clinical practice, I can refer to Madam Ainun for help and answers. The instruments that I will be going to use at the oncology ward are thermometer to check the patient temperature, blood pressure monitor to check the blood pressure, and the oximeter to check the oxygen level in the blood. Besides that, the modalities that are available at the radiotherapy department of HCTM are CT simulator and linear accelerators, like that. Before going for my clinical practice, I have asked my senior about what to expect for AKRT1. As a radiotherapy trainee at the oncology ward, our responsibility is helping the nurse to take the patient vital signs, patient transfer, and changing the bed sheet. Through this clinical practice, I hope to develop a good communication skills with the patient and the staff. As during the delivering of a treatment, some of the patients might not be compliant. So this is where a good communication skill will prove useful in comforting the patient. Lastly, for ethical consideration, I will not take any pictures and disclose any patient's identification such as name and IC number to the public. All patient information are strictly confidential. That is all for my pre-departure video. Thanks for watching and see you next time.